for Marshfield Clinic Health System, and we are the co-hosts of our Webinar Wednesday. This series is brought for you to educate you on things that are going on within our system or around the state or around the world related to healthcare topics, and focus mostly on the employer environment and that audience. So welcome again to another installment. We're happy to be here again today. Just wanted to point out a few things before I hand the baton off. We do want to hear from you and have your questions, so please use that chat feature, the Q&A feature that is up in the upper right-hand corner of your screen, and use that to ask any questions that you want of our guest as she is presenting today. We'd be happy to entertain those questions towards the end of the presentation, and we'll do our very best to get them all answered for you. Do want to remind everybody that anybody that pre-registered for this webinar and is listening today, have this emailed out to them, and we will get this out. Jen, I guess that's up to you to take care of that now. Jen is pinch hitting today as the host of our Webinar Wednesday, and she'll be pinch hitting for the next several weeks. So Ashley, who is normally our hostess, is going to be taking some maternity leave. So we're going to say goodbye for a short period of time to Ashley and welcome Jen back in. And let's see what else. So you'll get that webinar mailed out to you. Typically within about 24 hours of it. You'll also find it on the Security Health Plan COVID-19 webpage. So if you go to our COVID-19 webpage, click on the employer tab within that, it will show you this episode as well as all the past episodes that are out there. We do encourage you to listen to them again, share them if you want. And again, we'll do a survey after this is all over, and we do want to hear from you. So please tell us the topics that you want us to focus on, and we will do our very best to line up the guests to address those topics. So, Jeff, without further ado, I will hand it off to you.
Thank you, sir. Again, I'm Jeff Tucker. I'm getting an echo here. So can you hear me okay, Chris?
Mm-hmm.
Okay.
Yes.
I'm going to plow ahead anyway. So as Chris mentioned, there's a chat over. Please do go ahead and enter your questions, and Jen can let us know. If you have questions after, feel free to email us and we'll follow up with that. And without further ado, I'm going to go ahead and introduce Missy Degoda. Is it Degoda? Am I pronouncing that correctly, Missy? Did we lose Missy?
No, Missy's on mute. There she goes.
Oh, okay. Okay, thank you. For a virtual discussion about using population health solutions to guide your employees on a path to better health, which can help your workplace stay productive, contribute to a more healthy bottom line as well. Missy is Security Health Plan's Chief Clinical Officer. She's a clinician who is passionate about transforming healthcare through the design and delivery of innovative process and programs with a focus on quality of care, population health, and efficient, cost-effective service delivery. She has over 30 years experience in a variety of clinical and payer settings. As Chief Clinical Officer, she is responsible for operational and product oversight and strategic planning and execution for clinical, quality, and pharmacy programs supporting Security Health Plan members. Missy completed her Bachelor of Science degree in nursing at the University of Wisconsin-Oshkosh and earned her MBA with a healthcare emphasis from Lakeland College. With that, I will turn it over to you, Missy.
Thank you, Jeff. Thank you for that nice introduction. Good afternoon, everyone. Happy to be meeting with you guys today, even though it's virtually, and providing an overview of our population health programs that are available to Security Health Plan members. So really, we have a suite of programs that are part of your SHP package and really focused on, as Jeff mentioned earlier, improving the health of your members and creating a great experience when healthcare is needed by your employees. We can go to the next slide, Chris. Thank you for running. See if we can get that to move. Slide 3. There we go. So to talk a little bit, we always, especially with clinical program delivery and serving our members and really supporting their healthcare needs across the continuum of care, we tie all of our program development and fundamentals back to our mission and vision. So Again, it's been mentioned a little bit earlier, but we really are focused on supporting your employees and our members to reach their best health and have access to affordable and high quality health care. So you will see as we walk through the program overview as to what's available to your employees and our SHP members, you'll see how we're focused on that, on kind of 4 different areas, and we'll talk about those areas as we walk through the presentation. Go to the next slide. So a little bit about population health management. So it's a term that's very common in the industry today. It's common in both care delivery locations as well as with insurance payers and others. It's really taking care of a population, no matter what the issue or concern is, to improve health outcomes. And when we say it's across the care continuum, really the focus is we use a set of tools and technology to identify different populations and then create targeted programs and interventions to support or meet their needs. And that can be anything from a very ill or injured individual all the way to the other end of the spectrum and someone that's well and just needs annual care and support and preventative measures. So we'll talk about all these and how they play into the quadruple aim, which is our model of care that we use to build all our programs and interventions for our members at Security Health Plan. Our programs will focus on cost, and keeping the cost of care low, quality, improving the quality of care that's being delivered, both member and their provider satisfaction. We want to work with both closely within our programs. We can go to the next slide. So let's talk a little bit about population health at Security Health Plan. So basically, we have an integrated product offering that's part of your benefit plan and a comprehensive solution, actually, where we're bundling that claims administration portion, care management, and analytics to really drive targeted interventions and solutions. You can see the cycle and the circles listed. Basically, we start out by looking at using our population analytics tools and understanding what your employee or population looks like, what your members look like, and what are predominant needs in the population. We take that information and really synthesize it into a consultative approach and really working with you and your members to determine what their care needs are or what their program needs may be. We have an integrated, if you move to the second bubble, we have an integrated set of clinical programs that we will walk through shortly, focused on optimizing utilization of services, as well as managing care to reduce cost and enhance quality. And then we have a reporting package on the back end that really is kind of a report card to show how your members are engaging and participating in programs, as well as an associated action plan where we can help you improve or focus on new needs for your population. So we'll move into discussing some of our programs at this point and giving you a brief overview so you understand the context and how critical it is for your employees to engage with us. We can go to the next slide. So we'll talk a little bit about utilization management now. So kind of the entry point, so we have a couple, so you'll see 2 segments here, actually 3. You'll see utilization management, care management, and wellness programs. And I'll show you in a little bit how those fall into the spectrum. Utilization management is really that prior authorization or predetermination process. This is I have a team of clinicians sitting within the health plan that works with each individual member's providers and care teams to make sure they get the right services at the right time in the right setting. So the focus of this program is really using evidence-based standards of care and medical necessity guidelines to review services that are being requested, and especially in some of the high-cost areas where you see in this third bullet, such as high-end imaging, which is like CAT scans, MRIs, et cetera, medical specialty drugs, which are high-cost drugs to often treat MS or other conditions, durable medical equipment, et cetera. Those are areas where we often find duplicative services or overutilization in some areas where maybe another setting or area might be more appropriate for a member, we actually will work with that provider to make sure that that member is seeing an in-network provider, has access to the services they need at the network level, et cetera. In addition, if you look at the fourth bubble, we also have a nurse navigator program, which I think is key to really helping members navigate the healthcare system as well as their providers. We work with both to navigate the healthcare system to meet their needs. And what that means is we often receive requests for members seeking care out of the area or out of network because they're having problems locating or getting into care in our area. Our nurse navigator will work one-on-one with that provider and that member to really make sure that that patient gets plugged into the services they need. The nurse navigator program is included free of charge to the members and is available during normal business hours. We can move to the next slide. So utilization management is kind of that front door. So we learn about cases and learn about members' needs through this, and then we have actually a very complex set of triggers and that really will identify a case if we think they have additional needs. So we talked a little bit about the care management component earlier. So you can see our population pyramid. This is a common look at a population when we run a set of analytical tools or run your population through an analytics engine. We typically see about 5% of an employee's population really kind of fall into they have a complex or really catastrophic need, or they have an acute injury maybe or illness. We see about 45% of your population that falls into what we call rising risk. Rising risk is really focused on those individuals with lifestyle changes that may be needed. Could be smoking cessation, could be weight management, could be early onset of high blood pressure, et cetera. That if we can get in and work with them early, we can keep them from like moving into a chronic illness category and really keep them well. And last but not least, our low risk population, which is typically about half of your population, are those that are typically well. They have an annual exam each year and don't have needs outside of preventative care. So you can see the different programs that are available to your employees that plug into each of these levels of your population. So we'll talk a little bit in detail about these programs. So first of all, in our care management space, we have three levels of programs that are available to members. So if you think about that rising risk or the high risk programs, we have the three programs available that are, again, we want employees and members to engage with these programs. So the first of all, we have I'll back up a little. All three of these programs are really focused on, if you look at the bubble to the right, we're really focusing on getting really great clinical outcomes for that member, which means reducing the length of stay in a facility, reducing the cost of care. We're there to coordinate that care for that member. We want to prevent them from having complications and ending up back in the hospital. And we don't want them to have to use the emergency department setting unnecessarily if they can't get the care they need when they need it. So you'll see focuses in all of these programs as we walk through them. So to talk a little bit, we'll go to the next slide, talk a little bit about transitions of care. This is a program where we have nurses available that are working with our members that are just recently discharged from a hospital. So they've had a care need, they might have had a surgery, they might have had a medical admission, they might have had an injury. We're working with those, we identify those individuals when they're hospitalized, and then we have a team of nurses that are actually going out to the medical record, looking at the discharge plan, seeing what that member needs, and getting ahead of what that member or employee needs so we can have them set up and ready to go to transition home. This does a couple of things. This helps them it helps get the patients out of the hospital sooner and back into their home setting where they're more comfortable, it's a safer environment, etc. It also makes sure that we don't have any gaps in that immediate period when they go home from the hospital. Do they have their medications filled? Do they have a follow-up appointment with their physician? Have they been able to get all their durable medical equipment or outpatient therapy needs met? We make sure all of those services are lined up for that member with the focus. The program objectives are listed there on the right, like we talked about earlier. If a patient, next slide there, Chris, if a patient has an additional need or what we call longer term needs, they could be a complex or catastrophic case. Many fall into the categories that you see. We have actually registered nurses, social workers, pharmacists, physicians, nutritionists, therapists that are on staff to work with this individual that has longer term needs. We will work one-on-one with not only the individual patient or employee, we will also work with their providers, the facilities and the service organizations providing care. The categories you see on the list are not all inclusive. They're just some of the more common categories we see in our case management area, with that focus on making sure that the care is available. It's that right care at the right time in that right setting, and that we have no gaps in care, which ultimately reduces cost and increases the recovery time or enhances the recovery period for the patient. In addition to complex case management, let me go to the next slide, Chris. We also have a chronic condition management team. I have a team of nurse educators that sit within the health plan that are focused on managing individuals that have one or more of the 5 diagnoses listed. Their focus is really education. In other words, we want to make sure that these folks with either one or more chronic conditions have access to the information they need to manage their condition and improve the quality of life. So how we do that is it's typically telephonic. We historically have provided face-to-face program offerings, but with the COVID pandemic, we are strictly working telephonically now. We're really focused on closing gaps in care with these members, making sure they're getting the labs, the physician appointments, everything they need to manage their condition well, in addition to getting their medications filled, and also adhering to that medication regimen as it's prescribed. Our focus is to really improve the individual with a chronic condition, their quality of life, and subsequently keep them out of the hospital and at home, functioning in their day-to-day life. So these are our care management. So we're really focused in that continuum. Sorry, I talked with my hands. Focused in that continuum on that more ill or sick end. We're going to think about the other end, or that lower segment of the paragraph as we move forward. Oh, I missed a slide, sorry. My apologies. Talking a little bit about the care management, just to give you a little deeper dive. The care management program resources and interventions. So you can see on the left, we have that interdisciplinary care team that we talked through earlier. We have a whole suite of clinical assessment tools and technology that our clinicians use to work with these members to understand and establish exactly what's going on with them, as well as set a plan of care to really move them to a better quality of life and subsequently impact the cost and the quality of their care. Things that we offer as part of these programs, and really a value add for your employees and you as an employer, are the services on-site and home and community, with those being telephonic right now. But hopefully, future state, we can resume that model. We have a nurse on call service, which is a service that where we are partners with our area home health cares. We can send a nurse out to an individual's home to do a safety screening. In other words, if someone's going home and it's a little questionable if they're going to be safe or have additional needs, we have a nurse that will go out and do an assessment at no charge to the member or the plan. In addition, we have things like telemonitoring services. where we can do vital sign monitoring and things at home, cardiac monitoring. We have asthma care kits, blood pressure monitors, and medication boxes for those chronic condition management programs. These are really tools that are available to your members to use as part of the program and take advantage of to help manage their condition. Now we'll move to that wellness topic that I was referencing earlier. So we've talked about people that really have an illness. Let's talk about folks in that bottom box of that pyramid or on the other end of that spectrum. We also have a wellness program that's offered to Security Health Plan members. And so this is any member that's 18 or over. And it's really, I really want to provide an overview of our philosophy. It is a comprehensive wellness program that includes an annual health assessment, and we'll talk a little bit about that in a moment. We think that every individual should have a comprehensive preventative exam annually with their primary care provider and have the opportunity to access a health coach when health risks are identified through that annual health assessment. So basically, the whole underpinning of our wellness program is an evidence-based approach that's really designed on improving your health, much of it lifestyle modification, and supporting you creating a culture of wellness at your work site. So let's talk about a little bit about the tools in the program. So you can see we partner with Webmd, which is our wellness platform underpinning. So our partnership with Webmd and electronic access to that tool is included as part of the wellness product. And that includes health risk assessment, which we encourage every member to complete. It helps us know if they have any needs, and then subsequently we can direct them to a program to meet their needs. It creates, when an individual goes out and completes the health risk assessment, that login and the results, it creates a customized homepage for that individual, giving them tips and tricks and educational topics, programs to participate in. It's really a robust offering to that member. There's digital health management, in other words, tracking devices and things where you can enter values in there and track those. We also have the availability through this platform, but not all employers use it. We have an interactive wellness rewards platform if you decide you want to design a program that offers incentives or rewards as part of your wellness culture and program in your organization. And we also have a reporting package that's available as part of that. We also provide an electronic package of promotional flyers, posters, email blasts that you can use to support your wellness culture. As well as we have additional services that can be added on to our wellness program, including a health educator consultation. We can do workplace assessments. We can do on-site health coaching, biometric screening services. So you can see kind of in number one the base package, but really number two, if you have a strong wellness strategy or want to build a strong wellness culture in your organization, we have the additional tools that are available to support that. You can go to the next slide, Chris. Last but not least, this is the newest component we've rolled out this year as part of that wellness platform and offering is Webmd One, which is actually a phone app that takes that customized homepage or based on that health risk assessment and really turns it into a tool for the individual. And through that tool, we can do surveys, we can do messaging to certain populations, we can push notifications, they can use it as a tracking tool, a member can use it as a tracking tool. So that's a new added value for this year. So we're super excited about that because, as we all know, everyone goes to their phone to manage everything from their banking to their health care. So we're excited to have this tool available for our members this year as well. So that was a quick review of the programs available through our Population Health Management Program at Security Health Plan. So I think we'll open it up to questions.
Awesome, Missy, and we've had some questions come in. So I'm just going to start here at the top. And how has the pandemic affected businesses' approach to population health over the last few months? What has SHP seen so far?
You know, we're seeing, we saw a shift maybe, and I'll use an example of maybe an organization that's trying to create a culture of wellness and really build out their programs and focus on the health. I think the pandemic across all employer groups has shifted some of the previous focus around population health or wellness to how do we manage day to day and how do we adjust our workforce, and as it relates to management of this pandemic and the requirements for social distancing. Maybe people are moving into the home. There's less opportunity to have group gatherings. So I think it's shifted our focus away somewhat, not intentionally, but it's the nature of what we're going through as a nation right now.
Thank you. And I'm just looking at the time, being conscious that we only have a couple more minutes. So if you have questions, please get them in quickly. I'm going to read the next question now. Does the employer know when one of their employees is being helped by these services? Is there any communication or alerting of the employer, or is that not possible due to employee privacy concerns?
We do not, the latter actually. Due to PHI and HIPAA rules, we do not share individual employee information back with the employer. However, in your employee group reports, you will note participation activity reports that are available, and that showing how many people were identified, how many engaged, so you'll know at an aggregate level what percentage of your employees are engaging with our programs.
Thank you. Who should employers contact if they want to start doing some of the wellness solutions mentioned in the presentation?
So we have a wellness manager that's embedded, Dave Shorier. Some of you may be familiar with him or have worked with him in the past. We can work through your account executive, and we can set you up for those conversations and to learn more about the services and opportunity.
Okay, thank you. And for those that may not be an SHP insured currently, feel free to drop either Chris Bruni or myself an email, and we'll make sure it gets to Missy and the team to follow up on. Next question, does the employer need to sign up for the WebMD platform or the Webmd One app?
Not to my knowledge. It's part of the intro packet when we roll out the membership folders. So there's information on how the members can engage and employees can engage in using that platform. I hope that answers the question.
I think it does. That's the last, I think, of our employer questions, unless we have some coming in, Jen. So with that, I will turn this back over to you, Chris.
Yeah, and just one comment I wanted to make. Everything, Missy, in your presentation is part of the package you get when you're buying insurance through Security Health Plan as an employer. So these are all things that you are already receiving. Please, please, please take advantage of them and encourage your employees and their family members to take advantage of them. They're there to help them hopefully get to a state of better health and to get into any of those care management programs so that they can actually have that assistance from our staff to really work through those and get the very best possible outcome that they can possibly get. Missy, anything I'm missing on that?
No, I just want to say absolutely feel free to engage with us at any point to learn more. We also have collateral materials like flyers and brochures and things that you can use in your workplace to promote the programs, because really we're looking to get those members engaged and really optimize the use of those programs. They're there to really smooth things out and make things better for all your employees when they're encountering a healthcare need.
Mm-hmm. Great, thank you. And of course, wellness, yes, as you mentioned, Missy, maybe we've taken, or as a society, we've kind of taken our eye off the ball a little bit during this pandemic. But if anything that the pandemic does tell us, it's that we need to continue to focus on all of these different activities to maintain the very best health. And it's not just about us as an individual person, it's about us as a whole society. So anything that we can do to maintain a healthier lifestyle and the programs that we have available to help members do that is really to benefit not only them, but the extension to their family and to their workplace and to our society in general. So with that, I'm gonna call this one to a close. So if we do have other questions that do come in after this, we will make sure that we address them and get those out to you, and we'll send that out to the entire audience. Of course, if you do have other questions, want to learn more about what the benefits are that are available to you as an employer, certainly work through your account manager here at Security Health Plan. You can work through your broker as well. They're very well versed in things that we do, and they can work with our staff directly as well. So Missy, thank you very, very much. You did a great job as always, and very happy to have this presentation today. So with that, I will sign off and say be well, everybody. Have a great rest of the week.
Thanks, everyone.
Bye, everyone.